Hi, this is JD. I'm inviting you to join me and Dr. Asante Leblanc right here on I-95.5 FM for our brand new segment, The Live Checkup, every Tuesday from 10:30 to 11 a.m. Together, we will take you on a journey of health and well-being as we explore every level of traditional and alternative medicine. Dr. Leblanc will be ready to answer all your questions on air. So tune in to the most interactive health talk show, The Live Checkup, Tuesdays from 10:30 to 11 a.m. This feature is sponsored by Unicoma Trinidad Limited. And those are the folks we need to say thank you so much first off as we dive inside another conversation of the Live Checkup. I'm JD, and on the line with me I've got Dr. Asante Leblanc, who is the owner of Victoria Clinic on Galley Street. That's in Woodbrook, somewhere there. And it's good to have you here as always, Dr. Leblanc. We have been so excited as soon as we wrap up this show, the doc and I have been just so excited to jump into the next one. And I know that's exactly how you feel today. So good to have you there. I know you're not in studio with me, but that's all right. COVID is just messing things up in this world, I'm telling you.
Good morning, JD. Good morning to your listeners.
How are you?
I am good, I'm here taking my licks, as my husband would say.
So you're being missed in studio, but of course it's good to know that we can still certainly dive inside a very informative conversation with you thanks to the technology here. Now, courts, again, we acknowledge them, and they're the folks standing behind our conversation. Last week, we dived into a bit of the vaccine. Some of the questions that, I've got for you today may still mimic some of those in case persons may have missed it last week. But I know when we wrapped up, didn't we have some very interesting conversation post-interview?
Yes, we definitely had interesting conversations.
And questions.
I inspired you and questions. I inspired you to get your vaccine. I'm so proud of you.
It is crazy out there, but, we got to do what we got to do in terms of taking care of ourselves. And that is each person's personal choice and doing what you need to do at this point in time. But I wanted to talk about this vaccine because someone like Sharon, I hope you're locked on. Good morning to you, wherever you are. She was one of the first persons who said, Jay, it is a conversation that deserves a part 2. So we will dive into this vaccine again. One of the first questions, and I know it sounds repeated for many of you essential workers, but we always have questions, right? So Doc, just tell us about the vaccine first off. Right now in Trinidad and Tobago, we have the AstraZeneca. Speak a little bit on it and we can dive inside of the conversations that I have to follow up.
JD, well, the AstraZeneca is one of the WHO-approved vaccines worldwide against COVID-19 virus, the SARS-CoV-2 virus. So the AstraZeneca vaccine, how it operates is that it's basically the code for a certain part of the protein of the virus is taken into the body with an inactivated adenovirus, which is a cold virus, but it's inactivated. What happens is that will take it in and it will introduce it to our immune system. Our immune system will then begin to recognize the protein that is made, which is the spike protein, as a foreign agent, and therefore begin to build a memory, an antibody memory against the spike protein. Therefore, allowing you, the individual who receives the vaccine, if you come into contact with the SARS-CoV-2 virus, then it has this spike protein. It starts to produce the spike protein in your body. Your antibody, your immune system recognizes that as foreign, and it already has the army ready and waiting to deal with that, and therefore mitigates the effects of the SARS-CoV-2 virus if it enters your body. So if you come into contact with the virus post-vaccination. So that's basically how the AstraZeneca works. And I want it to be understood, JD, that all viruses go into the body either enveloped or not enveloped, meaning covered or not covered. They're either RNA or DNA viruses. And they go into the body and they actually enter the cell that they're targeting, and they then take over the machinery of our cells to produce more of themselves and to produce the antigens which cause the response of our body and cause you to be sick, right? So it's not that we're doing anything that has not been done before, and so I want people to understand that. You know, we're not changing your makeup or your cellular makeup at all.
Everything's pretty much the same. One of the things, I think we touched on last week, and I just want to have that clarity for some persons who may still ask that question. What are the differences between just yesterday? In fact, let me say good morning to my friend Rayanne, who's locked on in Belgium. And she was speaking to me yesterday just about the different types, and of course, I remember you mentioned the one in Cuba and all of that. So can you just speak about the differences with all and maybe just zone down in terms of Trinidad and Tobago on why we have this particular one?
I think it's so we have mRNA vaccines and we have the AstraZeneca and the Johnson & Johnson, which are not mRNA vaccines. And then we have the 4 from Cuba, which have not been globally accepted as yet or certified by WHO. And we have the Russian Sputnik, and we have the Israeli, and we have many vaccines out there. But only 4 of them have been registered and accredited by WHO.
Right.
Why does Trinidad not have other vaccines? And I think it's important to understand and reiterate to everyone that you should not really try and look and evaluate and stack the vaccines up to see which one is better. Right now, the population, the scientific world, all of us globally, the vaccine that you have available to you that's WHO accredited is the right vaccine for you.
Right.
I say this because there are many other issues in terms of production of vaccine, transfer of vaccine, transport of vaccine, storage of vaccine. So we have to, as a world, we have to try and come together. I mean, JD, if you look at India right now, India was the producer of the AstraZeneca vaccine, and India was selling the vaccine and it was donating the vaccine to other countries. And now India is in a 3rd/4th wave, which they can't even deal with. They have over 2,000 deaths a day. I mean, they're reaching the highest numbers ever over the past 5 days. And they have now had to get donations of the raw materials to make the vaccine to vaccinate their population. So I think it's the right thing to say is whatever vaccine that's approved by WHO and is here is the right vaccine for you.
As you speak on India, Dr. Asante Leblanc, I'm looking at CNN TV and they're saying India battling devastating COVID, and they're talking about thousands per day. So this is just crazy. As you mentioned in India just for a second, so many things are happening across the world. And I heard this morning many countries are even sending vaccines across there to assist them as well. So
exactly.
So this is so important for us to really pay attention to the information provided by experts like yourself and do what we can to protect ourselves, because we certainly don't want to stand in any numbers close to anything or any sort of resemblance in terms of high numbers. We already have too many, if you ask me, and I'm sure you would agree, but it is a constant challenge and also our responsibility to stay informed. So I thank you for that, and I thank courts for this time. You know what, Doc? Speaking about courts, you know what I need to do, right?
Yes, I do.
Right, so let me just do that and come back. This is I95.5 FM. If you've got questions, we're going to try and make the link maybe close to like 10 to the hour. I'll invite the questions, but you're going to make them really tight today, guys. So if you've got questions for the doctor, please, you're allowed to certainly call in. Hold on, Doc. I'll be right back.
See clearly and choose Quartz Optical. We offer you free digital eye examinations by our highly qualified optometrists at our 14 locations nationwide. A wide range of designer eyewear for the entire family. 25% off when you bring us your prescription. Plus, we have affordable payment options for you with Quartz Ready Finance and our Forever 18 plan. We pride ourselves in providing you with the best eye care. Quartz Optical. Value you can see.
And welcome back to it. We're inside of the live checkup with Dr. Asante Leblanc right here in I95.5. I'm JD. 20 minutes before the top of the hour. Doc, here's the next question before we run out of time. Why do some people react differently to the vaccines? I'm guessing it's all about the individual, but can you speak on that just a little bit? And I've got an asthma question for you too, coming up in a bit.
Yeah, so everybody is different. As you said, everybody's an individual. So your response to the vaccine is based on your makeup, your genetic makeup, and how you respond. So, for example, I had the vaccine. We also know that the younger people who get the vaccine show a little more fever and chills and not feeling well after the vaccine in 24 to 48 hours post-vaccination, while the older generations are not showing the same response. So it's based on various factors. So, it's all about your genetic makeup and how your body responds and how it's responding to that vaccine when you get it.
So most recently we heard our Prime Minister was tested again and he is now negative, and we say thank God for that. So he has certainly stepped out of that area there. But, one of the conversations that was had early, and not just with him, with anyone who possibly got COVID-19, there's a certain time frame in which you can get the vaccine. Explain that to me, please, because I'm trying to see, is it supposed to be, as you mentioned, 6 months? You're hearing that. How accurate is that statement?
It's, well, what the studies are showing now, it's between 4 to 6 months post-COVID infection that you should get the vaccine. And that's an infection where you've had frank symptoms, right? That you should get the vaccine. So that is because based on your antibody response to the virus and to the infection, that is the recommended time frame to get the shot for the vaccine. Now, they have people, for example, who have gotten the first shot and then have gotten the COVID-19 infection, and so their second dose is delayed. In some cases, we do have to measure the antibody titers, meaning the amount of antibody in the body, to determine when you should get the second shot. But it's most times between 4 to 6 months post-infection that you get the shot.
That antibodies you speak of, is that something you come to your GP for and have that discussion as well? How does that work?
You have that discussion with the GP, but the GP will have to order the test.
Okay.
Yeah.
All right. So this is the live checkup. We're inviting your calls in just a few minutes. I'm seeing some questions on the Facebook page in just a few minutes. I'll share those. But last week, post our interview, we got a pretty long WhatsApp message from one of our listeners across in the East. And she was touching on, because she said, you mentioned those persons who are asthmatic should take the vaccine. That's one of the things you were saying last week. Mm-hmm. And she had a really detailed voice note in terms of speaking about different levels. You know, that's your kind of lingo right there. So if you can share with us the details of the question and just share the answer. So because I'm pretty sure she's locked on and would love to get some clarity on that.
So the listener, and I can't remember her name.
Sharon.
so Sharon, she's asthmatic, and she was speaking to us about what about if you have virally induced asthma. So the first thing I wanted to explain is that it's not viral induced asthma. Asthma is a hyperreactive airway disease. So it means that your respiratory system is hyperreactive. This means that and we have different pathways for asthma and the pathology or pathogenesis of asthma. Mm-hmm. So we have intrinsic and extrinsic pathways. Now, what happens with asthmatics is that you can have, if you come into contact with a virus or a bacterial infection, when your body responds, because of your baseline genetic hyperreactive airway disease that you have, you then can have an asthmatic crisis, right? Mm-hmm. So that's one thing to note. We have other types of asthma. For example, if you're exposed to certain allergens, exercise-induced asthma, temperature-induced asthma, and so forth. What I wanted to explain to her, however, was that the vaccine is not giving you the virus. The vaccine is not giving you an infection, mm-hmm. right? So the vaccine is not going to necessarily cause an asthma attack. You do not take the vaccine. If you're asthmatic and you have no acute crisis, you are eligible for the vaccine. In fact, you need to take the vaccine because the COVID virus infection is much worse than the vaccine if you're asthmatic. Mm. In a broader sense of it, right? Mm-hmm. And this is for the majority of asthmatics. So why do I say this, JD? Is because if you have the COVID-19 infection, you're actually getting a live virus, contact with a live virus, and you're then getting sick, and you're asthmatic. So your body will then have, you're more likely to have more complications, right? Mm-hmm. Whereas when you have the vaccine, your body is prepared for when you come into contact with the virus. And so the vaccine is not giving you the virus at all. The virus will not activate. The spike protein is not the virus. It's a part of the virus, and it's for your body to form a response against the virus and be prepared to fight the virus if you come into contact with the SARS-CoV-2 virus.
What are we going to do without you, Dr. Leblanc? I don't know. The live checkup. This is exactly where you're on I-95.5. Thank you again to our friends at Courts Unicoma. They're taking us through this 30 minutes. Now, I'm seeing some questions online. Just one particular question. So, basically, he's saying, JD, can you ask about the difference between the dead culture and the live culture? I hope you know what that means, Doc.
The what?
Dead culture and live culture. But let me go on to read what he says. That can be used in the development of related to the efficacy. And also he's asking, Keith, good morning, also asking about the mix and match of brands. But, let's say you take AstraZeneca today and in 6 months you take, I don't know, let's call another one Moderna or whatever it may be. How effective is that as well? And should that be
So
done?
I'm not sure I understand his live and dead culture question, but I assume that he's saying if we give a vaccine with a live virus versus a dead virus or inactivated virus. So the COVID vaccines are all using genetic material. None of it is using an attenuated virus, right? That's number one. Number two, we at this point in time, we are not recommended. It's not recommended to mix and match the vaccine.
Okay.
It's recommended that you stick to the vaccine that you got in your first shot. At this time, that's what it's recommended. And JD is important to understand it's a very dynamic situation.
Of course.
This entire pandemic is dynamic from day one. So it's really a live and learn and see how we go.
All right, one more question. Well, statement from Facebook, then we pay some bills. All right, saying thank you to our friends at court. Lourdes, who's locked on in Brooklyn. Good morning, Lourdes. She says, JD, just get something clear for me. I don't understand why the doctor mentioned the WHO vaccine is the right vaccine for you. So just go even deeper on that. What exactly do you mean? Right.
So the World Health Organization is accrediting the vaccines for worldwide use, for emergency use against COVID-19, the SARS-CoV-2 virus. So generally, the world is most of the countries are using the vaccines that have been accredited by the WHO and approving them in each country for emergency use by the government to immunize the population.
Right.
So at this time, we only have 4 accredited WHO vaccines. So that's Pfizer, Moderna, Johnson & Johnson, AstraZeneca.
Right.
So there are other vaccines that have to be accredited, but they're also still in their clinical trials and still being worked on. There are some countries, such as Russia, who has the Sputnik 5, that it has not been accredited by WHO, but some countries have chosen to use Sputnik 5 in their immunization rollout program.
Really? Okay. All right, so we're going to take a pause, come back, and then we jump into your phone calls. You ready for that?
I am ready.
I know.
Yes.
All right. This is I-95.5. You're inside the live checkup. Please don't move. We'll be back in a second.
See clearly and choose Quartz Optical. We offer you free digital eye examinations by our highly qualified optometrists at our 14 locations nationwide. A wide range of designer eyewear for the entire family. 25% off when you bring us your prescription. Plus, we have affordable payment options for you with Quartz Ready Finance and our Forever 18 plan. We pride ourselves in providing you with the best eye care. Quartz Optical. Value you can see.
And those are the folks we're saying thank you very much for this 30 minutes. Well, we've got 10 minutes left. Guys, you are invited to call in if you've got any questions, 622-EYES. And remember, your questions are going to be on point, quick, and to the point, so we can certainly get as many answers out of the doctor as we can. All right? The live checkup on I-95.5. Good morning, you're live.
Yes, hello, good morning.
Good morning. What's your question?
How long will this vaccine last in the body? You know, sometimes when you take a vaccine like the polio vaccine, you don't have to take it ever again. You know, if you take this vaccine now, will it last for years?
All right, listen off.
Take any again?
All right, thank you for your question, Doc.
Yes, so there are some vaccines that you take and you don't have to take again. The polio vaccine does have boosters, by the way. Right now, all of the COVID-19 vaccines have been noted to extend at least 6 months of immunity once the entire dosing schedule is completed. They're still being studied, so at this point in time, we know that up to 6 months for sure, you have coverage from the vaccination, the full 100% vaccination. So we're still working to see how long and if we need to take boosters. Some news did come out recently that they have anticipated that they will need a booster for Moderna and Pfizer, but they're still using a 6-month schedule. But as of now, we're looking at 6 months immunity, and we're still watching to see how it goes worldwide.
All right, thank you for that answer. Shari, that's not what the doctor says. The 4 that are recognized, Shari, sorry, Dr. Leblanc, I know you're not in here, has posted a statement, so the Moderna vaccine not approved. That's not what the doc said. She said it's one of those that are approved.
Yes.
Yes? We gotta be, so I take my time and say it.
Pfizer, Moderna, AstraZeneca, and Johnson & Johnson are the 4 accredited vaccines accredited by WHO for emergency use by governments in the immunization program against COVID-19 infection by the SARS-CoV-2 virus.
Thank you very much for clearing that up, Doc. All right, here's another question. Hello, good morning. What's your question?
Hi, good day, Doc. I had the virus 8 months ago. My symptoms was not virally, in other words, it was a severe back pain. I am 57 years of age, and the environment that I work, we sell medication. So I'm meeting all the time. I'm the receptionist, meeting customers. That is how I got it in the first place, meeting the seniors. I need to know if I can get the vaccine right now after 8 months.
Thank you for your question. Doc?
That question, JD, and yes, you are eligible for the vaccine. It's been 8 months, so you are eligible for the vaccine. As long as you have no clinical signs and symptoms of being ill right now, you are definitely eligible for the vaccine. You are 57, however, and so our phase 1 was those 60 and over with comorbid conditions, and also the frontline workers, no matter what age, as well as the parliamentary workers, media, and so forth. But you are eligible for the vaccine. You will have to check with your local health center to see if they will give you the vaccine.
Thank you very much.
Based on your personal history.
All right. Here's another question. Hello, good morning.
Morning, JD.
Good morning.
Morning.
What I would like to find out is that the vaccine, when you are a candidate for the vaccine and you go to your, is it advisable that persons taking their vaccine be tested for the virus before getting the vaccine, bearing in mind that someone like Dr. Rowley Case, he had the virus and he has to wait. Now, there are people who are asymptomatic. Is it possible that is it better to test, or we can give it to anybody who comes in? Thank you.
Thank you.
Right. So that question is a lovely question. So according to all of the scientists right now and all the information we have now to date, JD, if you are symptomatic, then you cannot take a vaccine. If you have any kind of viral illness or any kind of illness right now that is frank with fever, coughing, and all of these symptoms, you should not take the vaccine. If you have the infection, a COVID infection right now, and you're showing signs and symptoms, you cannot take the vaccine. If you are asymptomatic and you have the COVID infection, then right now what they're doing is they're not recommending that you be tested. But if you know that you have the virus, you are positive, even if you're asymptomatic, then you should not get tested. There is no mandate right now to test everyone before the vaccine. Right? So right now it is that you have the vaccine. As long as you have no symptoms and you're eligible, you have the vaccine. They are not testing right now before the vaccine. And it's simple, JD, because if you have a frank illness, you should not be vaccinated. No matter what the vaccine, if you're sick, you do not get vaccinated. At that time, you delay your vaccination.
And you should be home, right?
And you should be home.
Yeah.
But if you have no symptoms and you're fine, then you are eligible for the vaccine. And we have not seen any major contraindications to asymptomatic persons having the vaccine.
Thank you very much. We've got so many more questions and so little time. Let's see how we do this. Hello, good morning. What's your question?
Hi, good morning.
Morning.
I just concerning if I take the vaccine, will it prevent me from getting COVID? Because in the early days, the vaccine will stop the pandemic. And if I get in the wrong message, is that it don't stop you from getting the COVID, and I can even spread it even though I have COVID after I get the vaccine.
All right. Listen off air for your answer. Go ahead, Doc.
So the vaccine, I love this question because the vaccine is just another protective shield in coordinates along with the other measures we have, JD, which is the washing of hands with soap and water, right. Sanitizing your hands if you don't have soap and water at hand, social distancing, wearing your mask properly, covering your nose and mouth, and knowing that if you're sick to stay home. So the vaccine is another shield to that and another level of protection. Now, that being said, if you are fully vaccinated with both doses, let's say for the AstraZeneca, and along with all the measures and all the protocols we have already established in the country, then you are less likely to be infected by the SARS-CoV-2 virus, right? Now, if you are infected, let's say you did not obey the protocols, you thought that you're vaccinated and that's fine, you can go and do whatever you want. You may get the SARS-CoV-2 infection. However, because you're fully vaccinated, your signs and symptoms will be, your disease will be mitigated. It will be attenuated in terms of how you respond to it because your body will fight the virus because it's prepared for that. If you do get a frank infection, however, then you can spread the virus. So that is why it's important to understand that vaccination does not equate or is not equivalent to dropping our guard. It is another protective shield for us to then have the country and have the world so immunized so that the virus then realizes basically it's fighting a losing battle against humanity, right? So that is why we're trying to achieve worldwide herd immunity through the vaccination program globally.
All right, so let's go for another question. Hello, good morning. You're live.
Morning, Deji.
Good morning.
Sorry.
No.
Morning, Deji. JD, morning, doctor.
Morning.
I want to find out. I'm 74 years of age, and I have blood clots on my right arm, 3 of them. I have one on the right side of my back, over my butt, and I have a problem with circulation on my left leg. Is it possible that I should take the vaccine? But my daughter already signed me up and everything. I don't know what to do.
All right, listen off mic. Yeah, there you go.
Right.
All right.
So that is a very complex question, and I really advise that you have, because I won't know all your history and your questions. I really would have to ask you to give you that information. You do have a valid concern, and I would recommend that you speak to your doctor and go through everything to understand your risk and understand if you are at risk if you take the AstraZeneca or not. There has been talk, and we do know that there's a very low risk of certain blood clots with the vaccines, and it's not only the AstraZeneca vaccine. It's important to understand that, JD. It's with the Johnson & Johnson as well, and we also saw it with the Pfizer and Moderna.
Ooh.
That being said, the risk of a clot is so much less than even smoking, as we discussed, pregnancy, and the birth control pill. However, if you do have a propensity or you have the potential to have a clot-forming situation in your clinical history, in your medical history, you do have to speak with your physician so that you all can go through the steps and weigh the pros and cons to advise if you need to be vaccinated or not. So definitely speak to your doctor.
Speak to your doctor. All right, this is my final caller. Hello, good morning. You've got 30 seconds. Let's go.
Morning, JD.
Morning.
JD, I would ask the doctor, if you have you have a heart problem, is it right way to take this vaccine?
All right, listening.
Yes.
Yes.
I love that question. Yes, you have to take the vaccine. You're eligible to take the vaccine because a heart problem, a cardiovascular problem, that falls into the whole group of the NCDs and the comorbid conditions that you're hearing everybody talk about when we hear of the deaths in Trinidad and Tobago due to the COVID-19 infection and worldwide. So you are a high risk. If you get COVID, the SARS-CoV-2 infection, then you're at a high risk for complications and even death. So you are encouraged to take the vaccine so that we can mitigate that complication and save your life. Please remember, the viral infection, the infection by the SARS-CoV-2 virus is what kills, and we're trying to save lives. We can do this together, and we need to do this together, JD.
Dr. Leblanc, thank you so much for your time, as always, inside of the live checkup and also answering all those questions. And there are many more, but we've run out of time. We're getting closer to the top of the hour.
I guess you're going to have to consider a part 3, JD.
I was thinking that as you were speaking.
We're doing I think we need to answer the questions. We really need to help spread the word. We need people to understand what we're fighting. And more we're seeing this virus trying to mutate. And we now have seen that we have certain variants in the country. So we need to come together as a population and be responsible, do what we have to do, follow our measures, and get vaccinated together with all the protocols established so that we can save lives and get on with our lives.
Yes. Thank you, as always. Doc Onika's in studio. She's getting ready for the news at the top of the hour. But before you go, let's just remind the listeners, you can send that email to the live checkup tt@gmail.com if you have any questions that you want us to touch on next week, let's say, or...
And hi, Onika.
She's smiling. So again, the email address is I should put you on mic. Say hi, Onika.
Hi, good morning.
Good morning.
So the live checkup tt@gmail.com. Thank you again, Doc, and thank you to our friends at Quartz.
Thank you, Quartz. Yes,
right.
bye-bye.
Take care, bye.
See clearly and choose Quartz Optical. We offer you free digital eye examinations by our highly qualified optometrists at our 14 locations nationwide. A wide range of designer eyewear for the entire family. 25% off when you bring us your prescription. Plus, we have affordable payment options for you with Quartz Ready Finance and our Forever 18 plan. We pride ourselves in providing you with the best eye care. Quartz Optical. Value you can see.